and welcome to the program. We are at the offices of Texas Senator Juan Chuy Hinojosa, 20th Senatorial District for the state of Texas. Juan, thank you for having us at your office in McAllen, as it were, but you also represent City of Corpus Christi and everything between McAllen and this part of Hidalgo County all the way through Brooks County, Jim Wells County, over into Nueces County, and so a lot to talk about.
Well, you're welcome, Ron. My district's pretty large. It's over 850,000 people. Sometimes I think it's probably closer to 1 million. But it's a large district, and I'm very proud to represent from Corpus Christi, Alice, Jim Wells, Fremont, down to McAllen, Peñitas, La Jolla, and Sullivan City, and all the little small towns. Good people in my district.
A lot of responsibility. I've never asked you this question before. What in particular, and at what time in your life, what was the epiphany moment when you decided, you know what, I want to be a public servant? You remember that time?
Well, I've always wanted to be in public office in one way or another. I ran for student body president when I was in high school. I also
And this was in Mission?
I was in Mission High School in 1965. And ran for best all around. I enjoy politics. I enjoy talking to people. I enjoy meeting people. I enjoy dealing with public policy issues. But many times there's a moment in your life where there's an opening. You have to seize it. And my opening came when former State Representative Cullen Looney decided to retire and not run again. Wow. That was 1980. 1979, 1980.
Did he endorse you along with Judge Looney?
Cullen Looney didn't. No, he was not a Judge Looney. He was his son, Cullen.
Cullen was called Judge, right? Didn't they call him?
Correct.
Because he had been Judge. Go ahead.
Yeah, and Cullen decided not to run, so there was an opening, and I was driving to Corpus Christi, and somewhere between the checkpoint and Falfurrias, I made up my mind that I was. I would run. That I was going to do it.
Wow.
And sometimes you have those moments, and that's what you want to do. You got to move on them, and I did.
Wow. So up to that time, within your family, the thing that happened, it was kind of a whisper, kind of a feeling. But at that moment, between the checkpoint in Edinburgh and Falfurrias out there, that's a great place to really contemplate your future and what you're doing. When you leave the community at large and get kind of away from the busyness and so forth, through the ranch country, you can kind of settle in and you see those flowers, hearts-delight flowers near Falfurrias. And so that's where you made that decision. I'm going to do it. I'm going to jump in. I'm going to run for this office.
Well, I think at that time Eddie de la Garza had announced from Mission, and so had Matias Morin, a JP. Wow. And as I was driving, I was thinking, well, why not me? Excuse me, we didn't have any cell phones at that time, so as you drive on a long drive, you get a chance to contemplate, meditate, and think about issues and what you really want to do. And it was a nice drive, and I decided then, right then and there, that I wanted to run.
Well, let's go from that moment to today, when you're the senator for Senatorial District 20. Big issue this year is immigration reform, and in particular the humanitarian issue of all these humanitarian problems that has impacted on your region, the southern part more than your northern part, with these refugee children from Central America. The situation in their home country and in their community is so desperate and so volatile and so dangerous. They have determined they're going to risk their lives to come to the United States, in some cases trying to reconnect with a family member in the States. Where are you on this issue, and what needs to happen, in your opinion, that isn't happening now?
Well, first of all, I think the lack of immigration reform in Congress has led to this situation where we are overwhelmed by the number of young people coming in from Central America. Your heart goes out to these families who are looking for a better way of life and trying to improve their lives. By the same token, we as a nation have the right to define our borders and defend our borders. We cannot have an open door policy. So to me, as we manage the situation, here in the Valley, we have done a great job in taking care of these young people and their families. We provide them with shelter, clothing, food, healthy checkups. But at some point, to this point, the flow has not abated at all. And the reason is that there's a lot of violence in Central America, and the cartels are involved, and that they encourage a lot of these immigrants to come into the United States through human trafficking and charging them to get them to the border. And the difference is that once they get to the border, now all they have to do is surrender. They don't have to take him from the border to Houston or Dallas or up north past the checkpoints. So it's
maybe they've got an immigration attorney which has researched it and found that there's in fact a law unanimously passed by the U.S. Congress, signed into law by former Texas Governor George Bush, who was president at the time, and there is a refugee law that things are so bad in Central America that once they reach our shores, they're to be dealt with in a humanitarian way. They're to be reconnected with their family members or put in foster home, foster care, and so that's a federal law.
Well, that is what the federal law is, and it's a federal issue.
Yeah.
For us here at the state level, we still have to cope and deal with the overwhelming number of people that are here in the valley, even though from here they transfer and travel up north. Yeah. And I guess there's several issues. Number one, the Border Patrol is overwhelmed. They have their hands full, and they're leaving gaps along the border that expose us to drug cartels in terms of human smuggling and drug smuggling. That's where DPS steps in. The state has stepped up a surge of having more DPS officers to work with the Border Patrol and other local law enforcement people to fill in those gaps. Not to enforce immigration laws, not to set up checkpoints, but certainly to help with public safety, and that's what's happening. For us, we sometimes downplay the situation because we don't want to scare people off and make it seem like, well, it's an issue that we can handle. It is not an emergency, okay? It's a crisis. Then, no, it's not a crisis. Then what it is? It's a serious situation. The reality is that they're all around us, and they're here in McAllen, the bus station. But McAllen's not the only place and the only path they're coming through. They're coming through Mission, La Jolla, Peñita, Sullivan City. So McAllen, fortunately, has the resources, and the community here has responded very well. You have the Catholic Church, the private groups. They have really, Mayor Jim Darden's done a great job, so has Justin Garcia. But it's a problem that's a serious problem to me, and we need the state and the federal government to step up in providing resources. By that I mean money to pay for clothes, to pay for food, to pay for medical attention, and so on.
So the question when we return to the next segment is, Senator, do we really need these young people? Do we need more young people to add to our workforce base in the coming future of the United States of America if we're not having the kind of children we ought to have? We'll have that answer from him when this program continues, so stay tuned. Welcome back to the telecast. Your host, Ron Whitlock, with State Senator Juan Chuy Hinojosa, District 20 for the state of Texas. Now, Senator, when we went to the break, we asked you the question that the audience heard, and your answer is?
Well, I mean, what is the situation? The situation.
Do we need these children? Do we really need these children? Because the statisticians are telling us that our nation is going to rue the day that we said we don't want these Mexican-American workers coming from Mexico any longer, because we're not going to have people to do the kind of jobs that they are doing or would do in the future. And we really need these Central American refugees or illegals, whatever you want to call them, to be here in our workforce. So well, have them come.
Several points, Ron. Number one, there's no doubt that we need a young labor force to continue the growth in our economy. We need construction workers, we need hotel workers, dishwashers, we need trash collectors. So we do have a lot of jobs that go unfilled because American natives do not want to do that type of work. But number two, this is why we need immigration reform. We plan to, we know those type of work, we need workers, we need to do it in a manageable and orderly fashion. We can't just open our borders and say everybody come in and we don't know who they are. We have a right to know who comes in and who leaves our country. It's not like it was prior to 9/11. There are a lot of dangerous people out in the world, and I'm not talking about the Central Americans, but in other parts of the world, Pakistan, Afghanistan, in the Middle East, they want to destroy our country, and they did a lot of damage in the past in 9/11. So it's very hard for us to have a policy of just an open border. I think sometimes I think as I meditate and think about some of these issues, maybe some of these young people ought to be adopted by American families and raise them, educate them, and let them become citizens and be productive.
And become a doctor, become an attorney like yourself.
We can do that.
Sure.
But we cannot lose control of the situation where we cannot control the number of people coming into our country and identifying who they are based on our country's needs and our country security.
Looking at a copy of the McAllen Monitor where they say you laud the DPS funding, and that was done by the Speaker and the Lieutenant Governor and the Governor of Texas to fund a surge to take care of this humanitarian issue. Why do you think this is something that you support? You're a big supporter of DPS. You have fought for them and funding in a large way by virtue of your information on your website.
Well, what happened, Ron, there's no doubt that DPS does a very good job in terms of public safety. And many times during campaigns, issues are politicized. You remember during the Lieutenant Governor's race between Lieutenant Governor Dehurst and Senator Dan Patrick, the issue of a permanent surge came up during the campaign. And people didn't pay much attention because they thought it was very politicized and that it was just being done for campaign purposes. And it probably was. But now when we need DPS and we need a surge from DPS to fill in those gaps that have been left open by Border Patrol not having enough manpower because they're dealing with the overwhelming number of immigrants, people then question it. Do we really need a surge? As I speak with my constituents and I hear from my law enforcement folks, we do need help along the border. There are huge gaps that are not being patrolled by Border Patrol because they are tied up with helping all the different immigrants and young people and families coming in from Central America.
Well, you bring up a good topic, and that is why not have these children adopted by somebody? Some of them are showing up on our shores, and they do not have a parent with them. Some are. And of course, the parents are not skilled, and they would be working in the private sector and doing ways like you're talking about, working in a hotel, working in a restaurant, those kinds of, in agriculture, where 1/2 of the agricultural workers in our country are undocumented. Think of that.
Correct.
They could be in that, but their children could maybe be educated if we would help them.
One of the policies that I do not agree with that we have in our country, and it is we educate people who are undocumented. They're young.
And make them get back to their country.
And after we educate them, provide them with a master's degree, a doctor's degree, an engineering degree, we send them back to their country. That doesn't make any sense. If we educate them and we help pay and subsidize education, they're very much Americanized. They speak better English than most of us, some of us. We ought to let them live here, become productive citizens, and contribute to our economy and our society.
Amen. Of course, we could talk about that for another hour and a half. We have something else to talk about in this telecast. So please stay tuned because we're talking about a Healthy Texas Initiative, a pilot program for South Texas that could completely renovate the entire medical care infrastructure and that sort of thing for the entire state of Texas. It's pretty exciting, so stay tuned. We'll be back in a moment. Well, hello, welcome back. If you're just joining us, we're at the offices of Texas Senator Juan Chuy Hinojosa, Senator for Texas Senatorial District 20, runs all the way from Corpus Christi to Nueces County, Coastal Bend, where the Harbor Bridge is there. He's going to try to fix that up, of course, coming all the way down to Sound of McAllen, through Valpurias, Fremont, Alice, and all of those communities in between. Now, the Texas A&M and its extension service, its public health organization, Institute for Public Health, and all of these many things in Texas A&M and Corpus is for the area. Of course, A&M's in Corpus, it's in Kingsville, it's in McAllen, it's in Weslaco. The entire South Texas region has got the A&M footprint, and it's trying to do something very exciting because it's trying to create an awareness, promote behavior change, let people try to be ahead of the game. And tell us about it, and why are you engaged with it?
Well, it's called the Healthy Texas Initiative. As we all know, healthcare is extremely important and very expensive. And
Austin doesn't like to send those dollars to the border.
Well, it's just not a border issue. Actually, it's a whole national issue. But let's talk about Texas.
Yeah.
We have here in Texas, obviously, population is getting older. We're living longer. We have better health care, but it's also a lot more expensive. And in many ways, we don't take care of ourselves in doing preventive health. And A&M is a great university in terms of research, but they also have a system in place through AgriLife, where throughout the state of Texas, they have an agent in every single county of the state of Texas.
Historically called the county agent.
254
FFA, 4-H farmers, ranchers.
And they have more than one person in each county.
Yeah.
But what's important is that throughout their existence, they have helped farmers grow their crops, help with diseases, how to help with the cattle and raise them and maximize the cattle, the food production. And they do a lot of research in coming up with cures for different diseases that impact our plants and animals. Well, they also have a medical school, a health science center in A&M College Station. Well, why not combine those two resources and focus on creating a healthcare institute where you coordinate not only the AgriLife experience, the contacts and the resources with that of the Health Science Center, where there is a dental school in Kingsville. We have a public school of rural health here in McAllen. We have in Corpus Christi a A&M Health Center. So we have all the structure in place. What is missing is the coordination and the resources so that there is communication and focus on the most prevalent diseases that we have here in South Texas, like diabetes, infectious diseases, obesity, asthma, and measure that in terms of where we are now and where we'll be in 2025. And doing that in such a way that we get all the healthcare providers involved. From that, I mean doctors, hospitals, the managed healthcare companies that manage and provide reimbursement to healthcare providers. Put all that together and
one side.
Yeah, and
then on the other side, the farmers, the ranchers, what they're growing, and try to encourage these people to maybe grow their own in a vegetable garden, that sort of thing?
Well, the experience that they had in terms of the research, using that same experience to focus on people, not just on crops.
And what they eat.
Well, yeah, of course, what they eat, and try to come up with a preventive health. I think it's important. Many times, families, quite frankly, we don't take care of ourselves.
We tortilla de harina, chorizo con huevo, all that good stuff.
Too much tamales and tortillas. But the reality is we can still eat that, but there are other things we can do to help ourselves in terms of taking better care of ourselves and our bodies. And also the research resources that the A&M university and the health science center bring.
Has the umbrella. That's
and
the umbrella. Bring it all together. Got healthcare on one side and agriculture on the other. I like it.
Well, and the AgriLife folks, they're well trusted. They're known throughout not only Texas, but here in the Valley, they do a lot of outreach. We have the infrastructure in place. We already have hundreds of millions of buildings in place that provide for the health care, from nurses to dental care to doctors. So the infrastructure is in place. We may need another $15 million to make all the proper connections to make sure that the focus is dealing with the 4 more prevalent diseases that we have here. If we succeed, and we have a deadline of 2025, that we can actually measure the progress in terms of decreasing the number of infectious diseases, decreasing diabetes, decreasing asthma, then we can go statewide and implement the program. And A&M is a perfect institution,
no doubt,
that has the resources, has the research, and has the knowledge to be able to put this together and create this institute for health that will focus on this health initiative.
Welcome back to the telecast. Your host, Ron Whitlock, with State Senator Juan Chuy Hinojosa, District 20 for the state of Texas. You now have on your screen a picture of John Sharp, who's the Chancellor of Texas A&M. We have Senator Juan Chuy Hinojosa, and we also have Dr. Brett Guerrar. How do you pronounce it? Guerrar. Okay.
Yes. Guerrar.
And we have this is CEO of the Texas A&M Health Science Center. Now, these are the 3 individuals in the press release that's put out statewide to create this pilot project. Now, John Sharp, a very influential man across the state of Texas for a long period of time, says this will keep people out of hospitals while saving billions of dollars because of putting together the agriculture extension agent, talking to farmers and ranchers while growing healthy crops and livestock on the other end of the county. When in the southern end of the county, other end, otro lado, Health Science Center people, personnel, utilizing assets of our extension service, talking to families about how they grow healthy children.
We're talking about diabetes. We're talking about dental preventive health care. We're talking about medical checkups. We're talking about changing lifestyles in terms of what people eat, how to cook healthy. There is a multifaceted approach to healthcare that has not been done before. And on a long-term basis, it will save taxpayers hundreds of millions of dollars because people then don't have to be treated by Medicaid because they won't need the health care as prevalent or as many times as now. In addition to that, it will also drive down the cost of health care because we will not have people having to go and be treated for diabetes because they watched a diet and started at a very young age to be educated and to learn a certain lifestyle.
Do you think that they would be interested as part of this pilot to consider more of a homeopathic approach a little bit, which comes out of Mexico? The people in Mexico use herbs and teas and things of that nature to treat themselves, and they also prevent diseases by what they consume and what they eat. And like we go to the farmaceria and we go to the fruterias and we do this in South Texas, do you think that'd be a component of their pilot?
Well, they're doing that now.
A&M doing that right now?
Yes, sir.
Wonderful.
AgriLife.
I'm excited, really. I truly am excited.
AgriLife Extension Services, they have a promotora program. And since the 80s, they've always reached out to the colonias where they teach people how to use proper hygiene, how to properly cook food, how to take care of the children in terms of healthy meals, how to sew, and how to learn self-sustaining living skills. So we already have that in place. What we're trying to do is make that come together with our hospitals that work under A&M, with our medical schools that we have at A&M, and also with UT, with our doctors, with our healthcare companies that manage the healthcare in this region. Once we put all that together, then we're able to measure the progress in trying to focus and just deal with those 4 issues that I talked about, so we can measure progress, see if it's something that's effective and doable and workable. Most medicine is derived from plants and shrubs and herbs. And what's interesting is Chancellor John Sharp is a very innovative individual. And A&M is one of the world's leading research universities in terms of coming up with different solutions to different complex problems. And for them to take on this issue and subject matter, it's really a challenge, but also very optimistic in that we'll succeed in lowering the diabetes and the infectious diseases and asthma and other obesity issues that we have here in South Texas.
Senator, we appreciate very much you watching our telecast here today. You can also go to RonWhitlockReports.com and watch it 24/7 anytime you want to. Now, till next time, we're saying to you, adios.